Hey guys, welcome back to my channel. This is Dr. Patel with Harmony Oral and Facial Surgery. I'm a board certified oral and maxillofacial surgeon. So today we're going to talk about bone grafting. You may have heard this term from your dentist when you get ready for dental implants, or just in general when you are getting an extraction of some sort and you have dental implants in the plans. So what is bone grafting? Why do you need it? What are the different kinds? There are many questions that come to mind. And some of the questions you should really ask about, why you need bone grafting, what kind of material, what's the healing time, what do you expect afterwards? So that's what we're gonna go into today's video. So let's just start from basics, okay? Any time you consider getting a dental implant, it's important that we take a three-dimensional scan or an x-ray. It's called CBCT. It gives us a picture in 3D around the tooth. So we're really able to assess and see what kind of anatomy we're working with and the quality of bone, which is also very important when we're considering putting an implant in there. So the three-dimensional scan will give us an idea if you have enough bone, because teeth in the bone are not always straight in there. Sometimes they're angulated, sometimes they're really close to the teeth next to them, or sometimes they're coming out towards bone. Sometimes there's bone loss around there from the infection that's been going on with that tooth. So these are all the things we want to look at. And then after that, we make an assessment. Is this something where we can put an implant in right away when the tooth comes out? A lot of my patients tell me they haven't really heard of that. Well, it is a possibility depending on if you have enough bone available once the tooth comes out. So that's definitely an option you want to ask your doctor about whenever an implant conversation comes up. Another thing to consider is if you don't have enough bone, what does it take? That's when bone graft comes in, okay? So bone graft is essentially bone particles that get packed into the extraction socket once the tooth comes out. What is this material? So there are many different types of materials out there. There's something called xenograft, okay? Xenograft is animal bone, okay? There's something called allograft, which is a cadaver bone, which is what's most commonly used. And then there's something called autograft, which is your own bone. It's gold standard, but then that also requires extra surgery to collect your bone. And then they have some synthetic bones out there as well. My favorite go-to is allograft for many reasons. So allograft can come in from many different bone banks, okay? The questions you want to ask is, where is this bone coming from? What kind of quality of bone are we using? And not all bones are made equal. There are banks that are very selective about what they accept in terms of donation and how they process this bone. And all of this biology makes a lot of difference on how this bone will integrate with your own bone. Your body breaks down these particles. Sometimes they have growth factors in them that can help create new bone. And usually the healing time, you want to look at anywhere from 3 months, 6 months, to even 9 months, depending on how much bone we're trying to grow. So this is where the type of material and what kind of additives we're using really makes a difference. To even go into more granular detail, sometimes we even add something called PRF, which is essentially your own blood spun down, and we collect all the growth factors from it and we add that to the bone to really help expedite the healing. Sometimes, you may not have the healthiest blood that doesn't give us the healthiest growth factors, in which case we go with synthetic growth factors. We add that to the bone to help expedite healing. And there are many materials out there that we can use. Additionally, we also have to line all this bone with a membrane, is what we call it. It's essentially a thin paper-like material that covers the bone once it goes into the socket, and it prevents the tissue from infiltrating into the negative space where the tooth had come out. The tissue heals so much faster than bone. If we don't use any layer to separate the two, then tissue can grow in there, and then 3 months later when you get ready for implant, all this tissue has infiltrated into your bone side, and now you don't have healthy enough bone to put an implant in, and you may have to consider doing another grafting. So that's another thing to keep in mind. After the bone heals, it is also important to do another CT scan to be able to see what kind of healing we had. Do we have enough bone to put the implant in? So all these details have to line up before you get ready for your implant placement. okay? Just for a little bit of visual here. Let's say this tooth is coming out, okay? This is a negative space. This is where we want to graft. And every time you consider an implant, I am a big proponent of grafting because you want to have good bone all around the implant for implant to integrate with the bone. If this doesn't happen, then there's a risk of implant failure because implant is not necessarily going to be around all the bone, and implant doesn't really like to survive in an environment like that. And that's when you'll see failures, okay? All right, well, just to summarize, bone graft, there are mainly 3 different types. There's xenograft, allograft, autograft, and normally we like to graft when the tooth comes out. The healing process could be anywhere from 3 months to 9 months. And after that, we do another CT scan to make sure that we have enough bone laid in there to put an implant there that will be healthy and help you chew and function and look normal and eat normal. Okay, all right, well, thank you so much for following my channel. For more information and more videos like this, please follow us at Harmony Oral and Facial Surgery. And if you need a consultation, you can always call 839-400-2244. Bye-bye.